big things.
Cool. That's everything I'm going to need from you. Thank
Like
you, friend.
emotional trauma.
All right.
You're welcome to put the knife back when you're done, and I'll just give it a clean. Okay,
Yep.
so in a few moments' time, this is going to... Okay, so you can see now that it's still bleeding outwardly, and in a few moments' time, it's going to heal from the inside out, which means that it will scab naturally, but then when I'm gonna pick up the scab, and you'll still see blood coming out, but the cut won't be as deep as it was. Hello, friend. Welcome.
Hello. Sorry I'm late.
Oh, no worries. What's your name, my friend?
Ivar.
Ivar. Oh, we've met before. There's a seat here right at the front. Otherwise, I can just put down an extra chair. I think there's space back here. Yeah.
Wherever is best.
Here, he can take my chair. I'm more comfortable standing anyway.
Are you sure?
Yep.
All right. Well, there's a chair in case anyone wants it.
Okay, thank you.
Cool. Ivar, what's your surname again?
Leafson, son of Leaf.
Leafson, thank you. Is that Leaf as an L-E-A-F?
No, L-E-I.
Gotcha. All right, got it. Thank you very much. Okay, unfortunately, you've missed a good part of it, but I'm happy to just run you over everything you missed at some other point.
Okay, don't let me interrupt
There will
further,
be more
thank you.
alchemy classes. I'll probably have a second run of exactly what I mentioned here. Okay, so does anyone, except for Ivan, have any questions for me?
What if, let's say I'm smelting some bronze or something, and a chunk of it splashes out and gets embedded into the skin. What would I do?
So in that case, how big are we talking here? Like a fingernail sized or smaller?
Yeah, we can go with fingernail sized.
Okay, so when it is smaller, you wait for the body to just naturally push it out, depending on how deep. I'm assuming it's like fairly surface level. Then the body will push it out over time, but it will irritate your body. You will feel itchiness around the skin shortly afterwards. If it is bigger, then it is important that the object is removed. So what happens is when you've got objects in your body, so like we've all had a splinter, we've all had a bee sting, something like this before. Have you ever noticed how that wound seems to swell directly around the cut?
Yep.
Yeah.
So that is exactly what's happening, is your body is saying, hey, this doesn't belong inside me, get out. And so it starts swelling out because it sends fluids to the site of the injury and to address the problem. Now, when it's quite a large object, that is a very big problem because the swelling is called inflammation, and inflammation can be damaging to the body, which is very counterintuitive. You'd think that what the body is doing to heal you would always be good, but not necessarily. So if it's a large piece, it's important to get it removed safely and as soon as possible. So you can cut it out sometimes. Sometimes if it's like a very recent, fresh wound, you can just like pop it out. It really is a case-by-case basis. If you find that someone has been shot by an arrow and you need to get that arrow out, then it is important to, step by step, you don't lodge the arrow deeper. Whatever you do, don't lodge it deeper, especially with those bronze arrowheads. Those are lethal. I've seen those take people's lives before. Let's say, for instance, the arrow has gone through someone's arm and the tip is sticking out on the other side. You want to break off the shaft near the feathers and pull that through the body via the tip. Make sense?
Yeah.
Did I hear
Okay.
no?
Seems painful, yeah.
Yeah, no, it's incredibly painful. So you need to pull that out, and you need to be very careful such that you don't leave behind any splinters of wood in the body of the victim. If someone were to get an arrow wound just within the flesh, then you need to very gently, very slowly, basically wiggle that arrow out via the route that it came, so you don't cut any additional flesh. Shortly after you've done that, pour the boiled water I mentioned into the wound, followed shortly by one of the red health potions. If you don't have boiled water, another thing that I recommend, but it's going to hurt like a mother of a fuck, is the strongest alcohol you can find. Not mead, not muscle, the strongest alcohol. Like, stronger than vodka, if anyone remembers that from the Empire.
So the stuff that, if brewed the wrong way, you're gonna go blind.
Exactly. Exactly.
Okay.
Exactly that.
I brew that stuff all the time, yeah.
Wrong.
Okay, now on the note when it comes to brewing things incorrectly. So Ivar, I recommend when you have a moment, just look through the boxes at the back there. I've got some of the
Okay.
various potions, just the ingredients there. One of them is supposed to have 5 bones in them, not 4. And just see what patterns you pick up. It's
Okay.
very important when it comes to brewing these potions, you stay exactly to the recipe. Don't change anything. The reason why is because, like I mentioned earlier with the analogy of a fire, you can burn someone's body out in an instant if you give them a potion that is too powerful. You need to be sensitive to their body, need to be sensitive to their metabolism, and give them a potion accordingly. Cool.
How do you find out though which potion, like the small one or big one or even smaller?
It's a little bit of trial and error. So, for instance, I'm going to give an example of there was somebody in the Vale who had a bruise on the brain. So, that's blunt force trauma to the brain inside the skull. So, what we recommended was drink a potion every morning. And essentially, what that's doing is helping the body just heal that, get that bruising healed, and also prevent blood clotting. In that case, since it is a very regular consumption, of course, that person has to increase her calorie intake, but she also needs to water it down a little bit, just a little bit, so that it doesn't hit too quickly around the body. If it was someone came to me and they had just had a concussion, and let's say their spine is broken, for instance, then you need to make sure that the spine is as straight as possible, all the bones are where they're supposed to be, and then you give them one of the bigger healing potions. Cool?
I mean, yeah,
Understood.
sure.
Unfortunately, it's a little bit difficult to say where the bones are supposed to be without a skeleton to study. I'm sure that over time a skeleton will make itself available. For now, please don't go ahead and try find one.
I mean, we have all seen skeletons in the forests and in the swamps.
Oh yeah, those drowned men.
Yeah.
The thing is with the drowned men is it seems that their proportions are different to what a regular person's is. It seems that they have enlarged heads, enlarged limbs. It seems like there's some over muscle growth happening there. Okay, so who is ready for some practice?
Sure, let's go.
Okay, so what my idea is here is I'm going to act like a guide. So I'm going to observe and I'm going to point you in the right direction. Robert here is going to be our poor victim and we're not going to actually wound him. We're just going to pretend he's wounded. So I recommend that, or I'm going to ask that somebody comes up with an injury, comes up with a trauma process, and then somebody else nominates somebody else to try heal Robert over here. Cool. We're all right with that?
Yeah.
Everyone understand?
Yep.
Okay. So, who's going first?
What, no one wants to?
No, not all at once.
Okay, Robert, what injury do you have currently?
Currently, I've got a bad wound on my shoulder.
A bad
left-
wound on your shoulder. Okay.
My right shoulder.
Okay. So, who is going to treat your bad wound on your shoulder?
We need more information on the wound, please.
Well, you need to find that. Who's going to do the healing?
Need to cut his shirt open and get a look at it, right?
Don't cut the shoulder.
I'm not
Okay,
undressing
so
him.
step
but
one is, having a look at the wound is very important. In this case, since Robert is alive and conscious, He can take his shirt off himself if he feels comfortable. If it was
I
a
mean-
case of the person was unconscious, then yeah, you can cut off the shirt.
I mean, don't all get surprised at the amount of scars I've got, but alright.
All right. Okay, who's treating Robert's wound?
Fine.
Yeah, no one. Okay, let's
thank
go.
you, Saul.
Wait.
Well, you can work together. That's fine.
So let's see. What kind of wound will that be?
You tell me, you're the doctor.
So seems like a simple cut through the deltoid. Might be a scrape over the shoulder.
Robert, tell us what happened, how you got this injury.
This one was drowned man in Misfortune's Maze today.
A what, man?
A drowned man.
Oh, wait, what did he attack you?
Hit me in the shoulder with his axe.
Okay. So,
Yeah.
is that piercing or blunt damage?
This is more like slashing because axe.
There we go. There we go. So, what would be the best way of ingesting a potion?
First, pour some of the open wound, and
Here we go.
I think a little bit inside him also would work better, maybe.
There you go. Very good. Now, the next step is for Robert over here to make sure that he rests his arm for a while. Let that muscle actually heal up and settle back into his place. Okay, very good. So, right, nominate somebody else and tell them what. Ew, excuse me.
Bless you.
What injury they're treating.
Grover, can you come? Seems Robert is having issues with walking.
Talking or walking?
Walking.
I can talk
Uh,
perfectly fine.
We all know, but
Okay, that is
your
a
left
clue.
leg is damaged.
Am I too late?
A little bit, but you can come sit and watch.
Okay.
You need a chair, friend.
Yes, please.
Cool. Don't worry,
found
I'm
one.
going to have another class eventually, and then you can partake in that one.
Okay,
let's
perfect.
see.
Thank you.
There we go. Alrighty. Okay, so Robert here can talk, but he's struggling to walk. What do you do?
Give him some honey.
Yes, good. So when someone is in shock, shortly after they've had a traumatic incident, food, high sugar food, very, very good. However, because he's getting a potion, we want him to have good high calorie food as well. So perhaps some honey and some deer stew. That's an idea. Grower, what are you doing to help treat Robert over here?
Oh, I'm trying again. I think I seen it with my mother one time. She called it a recovery position.
There we go. Very good. What is the recovery position?
It's a leg over the other, and making sure the arms are somewhere at the front, but laying on your side.
There we go. So, can you explain to people what the recovery position is? Like, what's it used for?
If I remember correctly, it was to, in case there was blockage in the throat, to keep airways open.
There you go.
And-
Good.
And yeah, I think that was it really.
So, now, someone else's opinion. Why use the recovery position when we're worried about someone's legs?
Maybe so his leg does not move in the wrong way and damages maybe the ankle or whatever or the knee further.
There you go. Good idea. Another thing is, we don't exactly know how he acquired this injury. Perhaps it was a blunt force trauma to somewhere around the stomach region, in which case he could be feeling nauseous and he could pass out, throw up, all manner of things. So while we're treating the leg, we're also treating the potential side effects. Okay, so cannot walk, can talk. Tell us more about this injury on the leg. Can you move your foot? Can you feel your foot?
Yeah, I can move my foot, I can feel it.
Okay. Any numbness, any tingling?
Just a bit of pain.
Okay, just a bit of pain. Where is the pain?
Round the ankle.
Round the ankle. Okay, left side or right side?
It's on my left leg.
Okay, cool beans. So, this has obviously been an injury to somewhere around the ankle. Bear in mind that sometimes the body likes to move pain elsewhere. So, for an instance, we spoke earlier about how I'd broken my arm a while ago. When I had my arm in a sling and it was out of commission, I found pain in other parts of my body. I found pain in my back. I found pain in my shoulders. I had pain in my leg. And that's because your arm has a variety of functions, and your body behaves kind of like a tent pole in a way, where it's held up by all manner of ropes. And the moment one rope goes out of whack, it breaks, or it's too loose, or it's too tense, everything else has to compensate. And that's how pain travels to places you wouldn't expect. So now Robert here, with his presumably a sprained ankle, will obviously feel pain in the ankle, but come tomorrow he might feel pain in the calf, he might feel pain in his buttocks, he might feel pain in his lower back, might feel pain in the thigh. This is all various effects depending on the type of muscle that was in pain. Okay, Grower, who's next and what type of injury are they treating? As many details as possible.
Quick question, if I may.
Yeah, go for it.
So the traveling pain is gonna start after the treatment, or can it be like during the actual injury? Like if like patient says that, hey, I feel like pain in my stomach, although he has like a broken leg. Although I cannot see it. Like, is it? How do I treat like?
Yeah, that is a very big question. If it's shortly after the injury has taken place, it could be a case of there's a side effect that's coming into play. So, like, let's say someone broke their leg, but they're feeling pain in their stomach. I would think that's probably shock. That's probably the stress of the situation, and it's their body is so tense that it's affecting the pain in the stomach. If it's been a while, then it's a case of thinking, why is this body part tense? So with my broken arm, the reason why I felt pain in my shoulder is because all of a sudden my other arm was doing more work now. And now my back muscles, which power my arm, are moving differently. They're functioning differently. So it's going to be sore, it's going to be stiff afterwards because it's a new form of exercise. And then that might even travel down into your leg because your back is now functioning weirdly, so now your leg has to compensate.
Right.
But it's a matter of time. It's an art. It's not something you can study.
All right.
I need to step out for a minute. I'll be right back.
Cool. Right, Grower, what's up?
Oh, I was just wondering what kind of other injury I can think of on Robert. Do you have anything you're hurting, Robert, or are you fine?
I'm fine. Just make up an injury and see
okay.
how I can act to it.
His neck is broken.
There we go. His leg is broken. Which leg and
Oh.
where?
Oh, I said neck.
Oh, neck. Oh, very good.
that's a
Good
bit
idea.
Yeah, that's a bit extreme.
Okay, but it's a very good one. It's a very important one to know. So, who's treating a broken neck, Grower?
Well, I guess Ron Hall, because he suggested.
Aw. That's unfair.
idea.
What is this? All right.
Okay, Ronald, what are you doing?
Well, I mean, I think the most important part is probably not touch it and.
Exactly.
'Cause,
Exactly.
yeah, just-
When it comes to injuries of the spine, do not move the spine. If the
Yeah.
person is in immediate danger, you see the club of a titan coming down on them in 2 minutes' time, then absolutely move them. But shortly afterwards, you want to try keep that spine as straight as possible and just do not touch it. Okay,
All right.
what potions are you giving him?
Well, I suppose I will start with the small one. And so, are there any bits poking out, or is it just eternal thing? Robert, I think it's for you.
I'm unconscious. I've got a broken
Oh, you're
neck here. I can't answer you.
That's
If there
right.
are-
Yeah.
Simple thing.
I think-
If you see there are bits sticking out,
Yeah, then use your board
the
images.
one is deceased.
Oh. Okay, thank you. that's a good indication. Thank you. So I guess it's not. So then I suppose I should just have him like pour into his throat, maybe, like to make him drink it a bit, or I think
Yes.
that's maybe a good start.
So you have to be very careful with that to prevent choking. So yeah, the ways of there's other ways of dispensing potion to the body, which are, if we come to that situation, send me a raven rather.
Oh, okay.
Yeah. But yes, moving the body, and so you can sometimes have a broken neck and remain conscious. If he is conscious, get him to drink the potion. Get him to maybe drink some honey mixed with some water is a good idea, or some berry juice is also a very good idea. Get sugar into the body. Then you're going to put him on a stretcher. What is a stretcher?
Is it like a stick I can tie him to, or?
Yeah, it's very similar to a cart.
Okay.
It's basically you just slap the body on, and then, well, please don't slap the body on. It's a broken neck here. But yeah, so you put the body on the stretcher, and then it allows you to move it very gently, very similar to the way a cart functions. You're going to put him on a stretcher. You're going to get him to somewhere safe. Now, there's possible long-term repercussions to a broken neck. It could heal up okay at best. It could mean paralysis in one of the limbs. At worst case scenario, possibly the entire body. When it comes to paralysis, what is the best way of treating someone?
I guess it's gonna be again every day a little bit of red potion, probably.
There you go.
Might be the best.
There you go. So you're encouraging them to rest, and you're encouraging their body to heal. You're waiting for those. Does anyone know what a nervous system is?
Of course.
Okay, I'm hearing no idea and of course. So the nervous system is how your brain sends signals to your body. It's you can think of it like the roots of a tree. If your brain is the tree, then the nervous system are the roots, and they go all throughout your body. So they are what sends signals to your muscles to move, what tell your heart to beat, what tell your legs to run, what tells you if you're feeling hot or cold, all of these fantastic things. So his nervous system would be broken, put it lightly, if he has paralysis. So you're encouraging that nervous system to re-heal. You want to keep him still, but you want to keep him rested. But at the same time, you want to prevent bruising from lying down for too long. So every now and then, gently move him around, massage the muscles, keep the blood going. Cool.
That's a lot of information.
It is a lot of information. That's why I thought let you guys throw it at me.
Right. Quick question though,
Ronald?
something I come up with, if possible. So if the patient is unconscious, how do you get about injecting food into his system, their system?
It is very difficult. It is a very precarious situation. I recommend as watery as possible.
Right.
And then again, as I spoke about the boiled water, you want to boil it first. Make sure that you're not giving him the runny tums by accident. And then it's a case of very slowly to make sure he doesn't choke. Sometimes the body will, or most of the time, the body will automatically swallow. But it's also a case of you want to prevent choking as much as possible. So what I recommend you do is you hold the head up slightly so that the liquid runs down the neck and into the tube towards the stomach. No, the boiling water that's been left to cool.
Oh, okay. That's
Sorry,
that's important.
Not actual boiling water, yeah. Like tea. I mean, we don't have tea in the Vale here, do we? It's only an Empire thing.
I suppose.
I mean,
No, we
coffee
have
is almost the same.
We have some
yeah.
tea.
We have tea? Does nobody know how to brew tea? It's like you boil the water and then you let it cool?
I made plain tree needle tea.
Oh yeah. Oh, yeah, tell me about that. Yeah.
Okay.
Gives you line.
Cool. Ronhal, who do you nominate and what injury are they treating?
All right. Oh, I think Mira is sitting there not doing anything. Mira, come here. Look, there's a hole in his chest here. I don't think it's supposed to be there.
No, I don't.
I think it's
supposed to be there. I think.
Oh, his stomach rather. There we go.
Don't worry. There's not actually a hole there.
Yeah, it's no, hypothetically.
I mean, if it helps, we can make one, but
No.
rather not.
Oh.
No.
That's not necessary.
Robert did not sign up to be put holes into him.
All right. So, what does the hole look like, Mira?
Oh god, there's blood everywhere.
Oh,
Oh! What did you do? You're so beautiful, Robert. Okay.
Okay. So, is this a long-term, possibly chronic wound, or is it a short-term acute wound?
This is a short-term acute wound.
So, are you going to
Caused
get him to
by
drink the potion or
something.
pour it in?
I'm gonna pour it in.
Cool. Does it look like it was from an axe, from a club, from an arrowhead?
It looks like
Maybe
he
a
was
green eye?
impaled by one of the lightning deer.
Okay, cool. So, being impaled, when it comes to the chest, that is something that should be treated with great care, as the lungs and the heart are in the chest, and those are very, very sensitive organs. So, how deep is this wound?
Luckily not that deep, otherwise...
Okay. Can you see any organs, or do you only see flesh and red?
I'm not really sure what I'm seeing. Everything is pretty fleshy and red.
Okay, cool. Well, that's a good sign. It isn't very easy to tell the difference between various types of flesh. Muscle and skin tissue and fat tissue, very easy to tell the difference. Like a cooked deer stew, for instance, not cooked deer stew, raw deer. That's kind of what your muscles look like, and just a little bit more pink. When they're bloody and there's a lot of juice coming out, it's good. It means there's a lot of blood. When there's very little juice coming out, it means you're closer to the skin.
Well,
Okay, so
For
what are
Robert's
you going to
sake.
do here?
we are closer to the skin. And I'm going to pour the potion on.
There we go.
Look, 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 look.
Look, 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 look. Okay, so potion has been poured on. What is the next step of treatment?
Not sure.
Rest. Rest is the most important part of the treatment, and make sure that he's eating well. Because this is quite a, well, it's a hole, but it's still quite big. It's also important to keep it clean. So we want to make sure that when the wound scabs, no clothing scabs in it. What I recommend is some of the boar hide that's been washed, it's been treated, it's been dried, it's been left in the sun for 2 weeks to kill any germs on it. You can use that very gently as a kind of bandage, as a covering over the wound to keep it like nice and clean.
Okay.
Cool.
You kind of carry that around.
You want to try fasten it down to the skin. It's a little bit difficult. Because the hole is in the center of his chest, you kind of want to wrap around it in a diagonal motion to hold that binding there.
Okay.
Cool. Any questions?
How do I get him to eat if he's not eaten and he's unconscious?
Getting someone to eat if they're unconscious, again, as watery as possible and take it slow. If they're awake and they're not eating, you're just going to have to be persistent. You're just going to have to cook some really good smelling food and wait until their hunger system kicks in. Otherwise, just nag them. Just be like, oi, eat this. One
Okay.
bite.
Robert, you're doing much better now.
Thank you. Thank you. I no longer have a hole in my chest.
yay! Hooray!
Everyone
Yay!
liked that.
The hole is gone. Robert Linton was saved.
Okay, so I think it's been almost an hour and it feels like everyone is nearing boredom. So tell me back at me everything we learned today.
Holes are bad.
Holes are indeed bad. What else?
The recovery position.
Oh yeah.
There you go. Good.
If the wound is outside, you have to pour the potion on, and if it's kind of inside, like a blunt force weapon, you have to drink it.
There you go. Very good.
Always with a good meal.
Good. Very important.
Let's make
Honey is the base for a lot of potions, which are used
Yep.
for short-term recovery, not long-term care.
Good. Good. What else?
The ingredients of that small blue potion include 4 flint daggers for some reason.
No, man, that shouldn't be in there. There
Which
we
can't
go.
be good for your stomach.
No, please do not ingest flint daggers in any form and any quantity.
Flint dagger is just an ingredient for wounds.
Oh, true.
I see, it's a metaphor.
The anti-potion.
Okay.
Well, there was a lot
so,
of unconscious people, and that was really useful.
Yeah, so unconsciousness is one of the more precarious things in which it is, well, it's honestly, it's quite severe and it's very difficult to treat. Just care for the person, try to move them as little as possible. Oh, yes, thank you for bringing it up, because I nearly forgot, and that would have been devastating. So, I'm assuming most people here have encountered the blue mushrooms.
Yes.
Yes.
I have noticed that some people use them for their hallucinogenic effects. Please be very cautious with the amount that you take, because as found, Dr. Rook and myself discovered that they have very strong anesthetic effects, and when combined with potions, they can in fact knock you into a coma. What is a coma?
You don't wake up for a long time.
Exactly. You can sleep for months, even years, without waking up. And then the people around you need to make sure that you're fed, make sure that you're clean, all of these things. It is incredibly dangerous. I am documenting the effects because I found out that people using them as hallucinogens after I discovered that they are anesthetics. So just be aware. Please proceed with caution. If you encounter any side effects, any at all, please do send me a raven report back to me. My raven is a large brown owl. He goes by the name of Troy. If you see him, I'm usually somewhere around. He's either at the tavern, or he's at the keep, or he's with me.
A small suggestion from my experience, if you take the blue mushroom, it's relatively safe to take the black one also. The effect is gonna be weird, but some people have tested it out with lorexia, and it checks out.
Okay. Well, can you like make a note of the people who combine them, just so I can talk to them about the side effects? Don't say out loud. I don't
really
want
remember.
to name and shame.
There were 4 of us that day, I want to say. Shilwaxi also gave us yellow mushrooms as well. So we had blue, black, and yellow all at the same time.
How about those blood ones? Ugh.
Blood mushrooms?
Yes.
Sure. This is the first I'm hearing of this. This is very new information.
Yeah, I made one.
The teacher is the one being taught.
I wonder what if you take the blue, black, and red.
Tried it.
Who wants to? Who had it?
And no, never tried it, but I will likely one day.
Well, if you are still alive after that, just share that experience, please.
I could share some interesting information about blue mushrooms. I've been testing them. So if that's information may be needed, I could do that right now.
Yeah, sure. We can chat after the class. Okay, before we adjourn for the day, any more questions, any observations, any thoughts?
Robert here is a very good corpse.
Thank you.
Yeah, it's a very good corpse.
Well, body, I guess, not corpse.
Well done, corpse.
What do the corpses learn?
That corpse talks. Burn the bed.
Oh no.
Right, so, well, thank you everyone for coming to my first alchemy class. And if I may be so bold to ask, is there anything that you would change for next time? Like anything you liked, that you would improve upon? Or anything you disliked? Do you want improved upon?
I liked that you had us pick our own volunteers to help demonstrate what we learned.
Yeah,
Okay,
that was really good.
cool. And am I going to be seeing everyone here for the next time?
Goes properly.
Okay.
When is it gonna be?
Oh, I have no idea. I just need to get an idea of how many people
Right.
want to come before I organize that. Could be tomorrow, it could be 2 weeks from now, could be 2 years
That
from
would be
now.
great tomorrow.
I'd be
If
interested.
you have requests for any specific injuries and how to treat them, please do let me know beforehand. So, we had a lot of questions about the very typical blacksmithing injuries. I can absolutely do a class on that. I've got a book somewhere that would be of use for fletchers about what is the appropriate way of treating arrow wounds. I highly recommend that as well.
Did I miss
Friend,
the
are you a
start
spirit?
on-
Nameless friend. You have flames in your hand.
Whoa!
Whoa! What the hell was
What
that?
a show!
Yeah,
What was that Daya?
most probably.
Probably.
Never introduces himself.
I'm leaving before this place spontaneously combusts.
Why would it?
Alright, thank you for coming, everyone.
Thank
Thank
you
you
for
so
much for
teaching.
Yeah, it's a
great.
pleasure.
It was a great lesson. Well, a great bunch of great class. Thank you.
Great.
I'm glad. It was
Now,
a
who
pleasure to
wants-
host it.
Lesson.